Okay, good morning everyone. Welcome to Alexandra Hills. We'll talk about TAFE in a moment, but we'll do our COVID update first because we've got Dr. Young here and the Health Minister. So can I start by saying good morning Queensland, and it's a beautiful winter's day. We might just wait for Shannon.
Sorry, Premier.
That's okay.
Oh, don't bust me live.
That's right. Is everyone right now? Okay. Good morning Queensland, and we'll start with our COVID update. So we do have one new community case that has been reported overnight, but at this stage we're very comfortable that this person is in home quarantine and was detected from, remember we said that the woman went to the Portuguese Family Centre out at Ellen Grove, so this was a gentleman who was at that Portuguese centre. So we are going to be making sure that we keep a really close eye on all of those people who went to that Portuguese Family Centre, and it's very important that we monitor them because we don't want them out in the community, and I know Dr. Young's keeping a very close eye. We've got another 2 cases in hotel quarantine, so we're not worried about those. So we have 35 active cases, and in the past 24 hours we've had 13,887 vaccinations, which is very good. And then in more good news, I can also say to the people in Victoria, so remember we've had those restrictions on people in Victoria travelling to Queensland. So in good news, that will be lifted on 1 a.m. Friday. So that's great news for people there. I know there's a lot of people that would have had their holidays booked to Queensland, so Dr. Young's very comfortable where Victoria is at. And we're going to be keeping a close eye on New South Wales. And once again, I know the Health Minister will stress this, if you're a Queenslander, it's probably best not to travel to New South Wales at this time, but we're keeping a very close eye on New South Wales. Now, in relation to the transmission in the hotel, Dr. Young will now give you an update about that, but what we are, preliminary investigations are saying that the 2 people were vaccinated, but the virus was still transmitted. So once again, we still need to be very careful about what's happening in hotel quarantine, and I'll say this again, our hotels were not meant to be the last line of defence for this type of infectious disease. Put my plan to the federal government on regional quarantine, but I think we are going to continue to see this across Australia, and it's a real concern because as we're seeing, it gets out into the community, and then that means then that we're doing all the contact tracing and following up with that. So once again, so good news today, we've had that 1 case, but we've detected it and we're pretty comfortable where things are at the moment. So I'll hand over to Dr. Young to go into a bit more detail. Thanks, Dr. Young.
So yes, we've detected 1 community case, and this is a gentleman in his 60s who attended that restaurant at Ellen Grove at the same time as that person from Portugal attended. Now, he went into home quarantine the next day when he was contacted, so we're just confirming with him whether or not he went out and about on that Sunday morning. That would be the only risk. So we'll work that through. But all of the 36 people who attended that restaurant during the time frame when the lady from Portugal attended are in home quarantine. So we will continue, of course, to assess them and to test them going forward for the 14 days. So I think that's good news, and that's all in hand. Thank you to all of those people who attended the DFO, particularly the Cotton On store, for going into quarantine. So we'll continue to work with all those people. And I remind anyone who was in the CBD between 5 and 6 p.m. on Saturday evening to monitor very closely for any symptoms and to immediately get tested if they do develop any symptoms. So that's all very important. Now, we've done some preliminary work to investigate how the lady from Portugal became infected. And we have found that there was one of the quarantine staff, we think, potentially involved. This is very early and we need to confirm it, and we're looking at CCTV footage as I speak. But we know that this staff member escorted one of the positive cases from Mongolia from their room to the ambulance so that they could be transported to hospital. And we have the genome sequence from that gentleman. Then that staff member, who was fully vaccinated, as was the gentleman from Mongolia, they were both fully vaccinated. We then know that the staff member, after escorting that gentleman to the ambulance, went up to a higher level in the building and swabbed the lady who came from Portugal. And the lady from Portugal has then ended up with exactly the same virus as the gentleman from Mongolia. So we are thinking, but we really need to do further investigation, that through a fomite transmission process, that staff member has transferred the virus from the gentleman up to that lady from Portugal, and that's how that's occurred. But as I said, this is very, very preliminary, and we do need to look further into it before we confirm that that is what has occurred. It has helped us then in assessing the risks for the remainder of the people in the hotel, and we're just working with the airlines who have been fantastic, because it is an airline crew hotel, as to which people can then leave to go and fly on the various flights leaving Brisbane. So that's all in place. Then it's been really good to see that Victoria has got on top of their outbreak, and that means that we can reopen to all of Victoria, so including Greater Melbourne, as of 1 a.m. on Friday. But there have been some more exposure venues in New South Wales. So I reiterate that it is really important that people reconsider their need to go to Greater Sydney, and indeed there are exposure venues in broader areas of New South Wales, and overnight there's been 2 exposure venues in Canberra. So people really need to look before they travel for anywhere in New South Wales that there might be an exposure venue, and should reconsider if they really need to travel. And anyone who's been in New South Wales in the last 14 days, anywhere in New South Wales or the ACT, please could you go online immediately and check that you haven't been to any of those exposure venues. Now, we do of course get contacted by New South Wales with known contacts that have attended any of those venues, but we also know that some people don't always check into venues, so it's important that people go online and have a look. Thank you.
What was the time frame between that staff member escorting the person to the ambulance and then swabbing?
Yes.
And is that par for the course, or is that a breach of some sort of protocol?
Right, so the staff member escorted that gentleman who was positive from Mongolia at around 1:30 in the afternoon, and then the specimen, the swab from the lady from Portugal, was checked into the lab at 5 p.m. So we're trying now to look at whether we can narrow that down by looking at CCTV footage. But it would usually take several hours to get a swab from the hotel to the pathology laboratory, so the time frames fit.
So it's possible they might have gone to almost directly from one
Yes.
task to another?
Yes, it is possible.
Is there any indication, I know fomites, it's still
Yeah.
a lot of up in the air stuff, but is there any indication of how long something might remain on a person like that in order to transmit it?
We know it can remain for many, many hours. It depends on the environment, it depends on a whole range of things. So yes, we think that is a possible scenario. Remember, this is early in the investigation. It's the most likely explanation we've found at this time, but we do need to go and do more work.
Is that checking CCTV?
Yes.
In this latest case, are you concerned at all that there may be a window where they were out and about? Can you just confirm
Very, very slight window. So they left the restaurant at the centre there in Ellen Grove late on Saturday night, and they were called in the middle of the day. You might remember the Premier and I went out and did media around 10 o'clock Sunday morning, and while we were doing media, teams were calling those 36 people who had been at the restaurant. So yes, if they're an early riser, they might have gone out. But we need to talk to them and find out if they have. I think the risk is low, but we'll confirm that. So there might be exposure venues for that gentleman, and as soon as we get any of those, we'll put them up on our website.
Are the 2 overseas cases at the Four Points Hotel as well?
No, they're at a different hotel. They both were on the same flight from Mongolia though, so we now have 5 people who are on that flight from Mongolia.
Is that a potential breach of health protocol, that person not taking off their clothing, protective
I don't know. That's what we have to go and look at, and that's what we're looking at CCTV footage for. I don't know.
How much contact was there between the 2 people inside the Portuguese restaurant? Are they known to each other? Do they know if they were close?
We've only just found this information, and so that's all the work that's being done now, so we don't know. But we know this is a very infectious virus. This is the Alpha variant, if you remember, the one from UK that we're always very concerned about, so we know that it can transmit fairly easily.
What's the threshold for extending border restrictions with regard to Sydney?
It's when we've got so many cases that we can't manage it through only declaring venues. So at the moment, anyone who's been to a venue that's declared by New South Wales or indeed the ACT should not be leaving New South Wales or the ACT. So as long as we can still feel we've got some control there, and New South Wales and the ACT feel they've got control there, we don't need to extend that spread. But the issue is that they are finding more and more venues. So we just have to keep a very, very close eye on what's happening. And it's really important that people don't travel down to New South Wales, particularly Greater Sydney.
So as long as you have, as long as they're all linked, you're comfortable that you don't need to extend a hotspot to...
It's also the numbers, because although all of them have been linked and New South Wales has very good contact tracing in place and can link all these cases, it's really a matter of how many cases they're getting, because once they get to a certain number, they just won't be able to get hold of all the people.
Dr. Young, one quick question from us. We've interviewed a couple who were on a yacht this morning off the coast of Queensland who've been isolated at sea for 21 days. Both of them have had full Pfizer jabs yet. They've applied to quarantine or come into Queensland, and they've been told they have to do a full 14 days hotel quarantine. Why is that?
That is the situation at the moment, because we know that just because you've been vaccinated, as indeed we've seen today in this hotel transmission event, where the gentleman there had actually received both doses of the vaccine, the last one on the 15th of April, and we're now in June. So, and we've seen transmission happen. So we know that being fully vaccinated is enough to probably prevent you getting sick and you dying. In fact, most people who get fully vaccinated don't have any symptoms, which makes it even harder, because then they don't feel they've got symptoms, so they have to be careful. So being fully vaccinated is really, really, really important. I cannot emphasise that enough, but it's not enough to stop transmission. So while here in Queensland, I've got the numbers, so we're now up to 1.24 million doses have been given in Queensland, which is fantastic. 448,000 of them by Queensland Health, and we did 17,032 vaccines over the weekend, which was a fantastic effort by all our health staff, by the police supporting them, and by the community coming forward. That is all fantastic. But until we've got a higher percentage of people here in Queensland fully vaccinated and protected, it's not enough. So we have a nationally agreed position that has been discussed extensively, that at this point anyone from overseas, except from a green country, so New Zealand is a green country, so that's the only exception, does need to quarantine for 14 days when they arrive on our shores.
Does it matter that they've been fully isolated by themselves? yourselves on a boat for 21
Yep.
days?
So we do some work with Maritime Safety Queensland, and we do look at some situations, but it's really difficult to know that people have been fully isolated, so we are still taking that very precautionary process.
Would that be the same
Thank you. We're
grounds
going
for
to
rejecting
event
them?
now. Sorry, we've got to keep going because I'm going to go back into that function. Yeah,
So very briefly, because Dr Young has covered the situation with our community case quite thoroughly, the message for people in Queensland, unless you absolutely have to, we recommend against travelling to New South Wales at this point in time. We are watching very closely and monitoring it, and AHPPC meet every day to get briefings as well. So we do recommend against travelling to New South Wales at this point in time. But of course, we're welcoming people from Greater Melbourne back from 1 a.m. on Friday. We remind everyone about the travel declarations, and we remind everyone to continue to get tested if they have any symptoms whatsoever. Thank you.
Dr. Young, can we try one more, if I may? The gentleman who was taken to hospital, is that precautionary? Because you mentioned obviously the role of the vaccine is to prevent illness. Was he sick?
No, he's not sick. But in Queensland, every single positive case is admitted to one of our hospitals, one of our 5 networked hospitals that we've done a lot of work with to ensure air conditioning, to ensure all the processes, because our hotels are genuinely not set up to manage infection control. So we immediately, someone becomes positive, transfer them to hospital.
Can I just ask about, you mentioned in the paper interview your goal moving forward is to reduce smoking rates. Could you just expand?
That's not my goal. Of course it's not. I would love to see that happen. It would be fantastic to see Queensland become a smoke-free state, and certainly I've been working hard with government over the last 16 years to achieve it, and we've done brilliantly. We're down to 9% of adults. It would be lovely to see that even less.
Premier, got to keep moving. Just quickly on the regional quarantine. Is it time for Queensland to put forward alternative proposals?
No, we've got a proposal, and the officials are still working through that proposal.
There's going to be nearly a
Sorry?
dozen cases out of New South Wales today. Are you likely to put up the borders if that is the case?
I haven't heard that yet. As I said, Dr Young will be monitoring that situation very closely.
How many more vaccines do we need to ensure that those first vaccinations don't stop at the end of July?
Okay, so National Cabinet yesterday, we were given an update on the supply. There are some concerns shared across the state about the supply of Pfizer. In the last quarter of the year, there's going to be a lot of supply of Pfizer and Moderna, is what we were told.
Are you concerned about Gold Coasters having to come up to Brisbane to get their second vaccine?
Sorry?
Are you concerned about Gold Coasters having to come up to Brisbane to get their second dose because they can't get
Yeah, well, it's up to the Commonwealth to organise the supply, and they know where the supply needs to go.
The
Premier,
Commonwealth
Mark
says
Gilligan
we have
has been refused
160,000 vaccines.
I can't do two at once, so
So the federal government says that Queensland has 160,000 vials of Pfizer in the fridge not being used yet.
that's not my understanding.
About 15 days supply.
Yeah, and we are seeing our vaccination rates skyrocket in this state, and what we need from the federal government is constant supply. So that was what the purpose of National Cabinet was yesterday, where we got an update in relation to that. And as I said, the last quarter of the year is when those large volumes of supply come on. Up until then, it's going to be a bit of a stretch, and we've got to make sure now that we've got second doses, where we were told initially that the Commonwealth had the second doses. So the rules keep changing, and we're trying to keep up with what's been given to
Premier,
us.
just a question for Canberra. Mark Gilligan has been refused an exemption to see his dying father. Should common sense prevail in his case? I know he's written out to you.
Yeah, look, it's absolutely tragic. These issues are tragic. Unfortunately, the national guidelines, so it's what's agreed to federally, is the 14 days of quarantine for people coming overseas. That applies to everybody.
Can you intervene in this case, though, or will you?
Well, if the federal government wants to talk to both states, I'm happy to facilitate that, but this applies to everybody. This applies to everyone, every single person.
When young people are getting the vaccine that aren't in the eligibility criteria, is this wasting vaccines for people who are vulnerable to get their second dose?
No, it's not wasting at all. What we've said very clearly is that the priority is between 40 and 59 now for their Pfizer vaccines, and as the Commonwealth indicated to us, a large amount of vaccines are coming in the last quarter of this year. So we're going to be ready for that.
Premier, will you consider putting the borders back up if you see significant cases in New
We'll be watching it very closely. I'm not going to preempt anything. New South Wales does a very good job of contact tracing, just as the Queensland contact tracers do. So we'll be watching that very closely. And of course, if there is areas of concern, the federal government usually declares a hotspot like they have done in the past. Okay, now we're going to talk about TAFE, because that's why we're also here at Alexandra Hills today. So I'll get our wonderful TAFE people to come over. So we're here today to announce the completion of $10 million worth of upgrades to Alexandra Hills TAFE. This is fantastic news. This is an expansion to nursing, and in a global pandemic you want to see, of course, more nurses, so it's wonderful to see that part of the expansion takes on that. And the building behind us will also cater for plumbing, and I think everyone knows the high demands that our tradies are under at the moment, with a lot of renovations happening across the state. So it's my priority to make sure that we have the skills and training that our young people need for a great future, and that is exactly what we are doing by $1 billion in the budget for skills and training. And thanks to Don Brown, the local member here, who worked with us to save this TAFE, we are seeing this facility expand, and we are seeing massive investment. So this is the second $10 million that I have opened recently. Minister Farmer and I were on the Gold Coast opening the first one, and now this is the second one here at Alexandra Hills. So I might just hand over to Don Brown to say a few words, and then Minister Farmer, and then I think we will then go back to the function. Thank you.
Thank you, Premier. It's exciting to have the Premier and the Minister out here today. This is 6 years of work culminating in a massive $10 million investment into our TAFE. In 2013, I was out the front here collecting signatures to save this TAFE from the Newman government. To see it today transformed into a premier training facility is fantastic, and it's fitting to have also the Health Minister down here, because the investment of the new nursing training facilities will no doubt come in handy with post-COVID, with aged care, workers shortages, and also NDIS, making sure that we're training up the nurses for the future, but also the trades of the future. Again, I'd like to thank the Premier and the Minister for allowing us to have the funding here to have this massive upgrade. It's a very exciting day.
The Palaszczuk government has created almost 90,000 jobs since pre-COVID times, and we know that without a doubt our investment in skills and training is directly linked to those jobs. $1 billion, and because we know that if you have the right training, then you're more likely to get a job. And by the right training we mean investing where demand is really high, and investing in those areas where we know there's greater need. So the Redlands campus, the Alexandra Hills TAFE, is a classic example of that. This facility today is a $10 million investment into training for plumbing, nursing, construction and other related courses. And what have we seen over the last 5 years? A 126% increase in enrolments in exactly those areas. This is a TAFE that really links in closely to employers and to the local community, so they know where the demand is now and they know where it is in the future. And of course now we know that employers are absolutely crying out for skilled workers. And what sort of skills are they needing in this area? Exactly those things: plumbing, engineering, construction, nursing, and this is what this beautiful building is about today. And of course we know that this is a campus that Campbell Newman wanted to sell off. Thank goodness he didn't, because we are catering to demand here in this area.
Okay, thanks.